first, I do want to welcome John, who is a patient of mine at Vitality Medical Wellness Center that actually sought me out for some of the symptoms that he experiences. He works in the public safety. He's had fatigue, insomnia, some of the very common symptoms that we see right here in Las Vegas. And we're also going to talk to him a little bit about some of the experiences he's had at Vitality, some of the treatment plans that you've had over. And I want to welcome you to the show also.
Well, I'm glad to be here.
I wanted to talk a little bit, Bill, recently in the news this week, we've been hearing all about BRCA1, BRCA2. This is Breast Cancer Awareness Month for October. Last week on my show, we talked about hormone therapy and the risks with breast cancer, the possibilities that testosterone, and there's some new studies out there that show that testosterone, even in breast cancer patients, actually has a benefit. About 12% of the population is going to develop breast cancer at some time in their life. And there's been a lot of, in the news media, about breast cancer, the BRCA1, the BRCA2, and we want you to know about these genetic testings, who needs to have it done. Not everyone out there needs to actually have this testing done. And probably 1 in 10 cancers are actually related to the BRCA1 or 2 gene. And what is the BRCA1 and 2 gene? We want our listeners to know and be educated on this, why this gene is important. It's actually a human gene that suppresses tumor proteins, and it repairs the DNA, and therefore it plays a role in your cell genetics. So basically what it does is it keeps your cells healthy and prevents cancer growth. Bill, you have a couple tests over at Pathway Genomics. You've been on the show before. We've talked about weight loss and genes. And this testing that you provide actually is a little bit more advanced than the BRCA1 and the BRCA2 gene. Can you tell us a little bit about your True Care breast testing?
Good question, and great lead-in. Thank you. The BRCA1 True test that we have is related to the BRCA1 and 2 gene, just like Dr. Christy Thomas had spoken about. Now, she had talked about some statistics. I'd like to expand on that a little bit because 80% of families that have multiple cases of breast cancer or ovarian cancer have been attributed to the BRCA1 and 2 mutation. What does that mean? That means that if you have either a BRCA1 or 2 mutation in your genes, 80% of people that have breast cancer is associated with that. However, what Dr. Christy Thomas is talking about is our Breast True test. Now, that test is a little more expansive, and it goes beyond just looking at the BRCA1 and 2 genes. Those 2 genes are responsible for a great number of the breast cancers that are out there in male and female patients. However, the other genes that most people are not familiar with that are associated with breast cancer, we have a Breast True test, that's the name of the test, but it expands on it greatly in detail. And it goes into the BRCA1 and 2 genes, but it goes to the CDH1, the PALB2, bear with me here. There's a P10 and an STK11 and a TP53. That last gene I just spoke of has been recently found out to be attributable to a lifetime risk above 90% for patients that can get breast cancer. That's huge because the BRCA1 and 2 genes are responsible for around 80%. If this one, meaning TP53, is responsible for upwards of 90% for lifetime risk, that's something that a lot of patients that think, oh, I have a family history of it, I need to get tests for BRCA1 and 2, but don't either understand or know that there are other genes associated with breast cancer. And if they don't know that, then they can still get breast cancer later on, even if they don't have BRCA1 and 2. Does that kind of make sense, Dr. Thomas?
Exactly. And I think that people need to realize and be aware of that we're hearing a lot in the media right now because it is Breast Cancer Awareness Month, that BRCA1 and BRCA2, and to have people go out and get this genetic testing done. And I think there's a lot of fear out there because even when I work this business and when you see that on TV and when you're out there hearing about that, it's not necessarily that everyone needs to go run and get this BRCA1 and BRCA2 testing done. It's actually done in people that have risk factors, and we're going to talk a little bit about that who needs to have this type of testing done.